Next, we will discuss treatment options for heart attack. If you're having a chest pain, there are two kinds. You may just be having angina or you may be having a heart attack. If it is angina, your cardiologist will do an EKG followed by an echocardiogram and most likely a stress test to see, one, if the chest pain is coming from the heart, and second, to see what is your risk of having a heart attack in the future. If he diagnoses you have angina pectoris, which means that you have blockages in the heart that should be treated, he would start you on medications like aspirin, statins, and beta blockers. All of these can decrease your risk of having a heart attack in the future. If in case you're having a heart attack, then immediately they would institute treatment in the hospital. Basically, they would immediately take you to the angiogram suite. After they put you on appropriate medications, do a procedure called angiogram, where they put a tube through either the groin or through the hand, inject a dye to see the circulation, see where the heart attack is coming from, put a wire through the blockage, and open the blockage, called percutaneous intervention. That is usually done in the hospital in an emergency setting. If you're diagnosed of heart failure, they will start first to see if there's any reversible cause for your heart failure, where the most common cause of reversible heart failure is coronary artery disease, which is a blockage in the circulation of the heart. So the cardiologist would see if anything can be done for the circulation to be restored. If the circulation is normal and you have a weak heart, they would institute treatment to decrease the excess fluid in your body, and then institute other treatments that can make your heart function better. If after treating you with medications, your heart continues to be severely depressed, then there are new modalities of treatment that can prevent you from dying suddenly by things like a biventricular pacemaker or a defibrillator can be placed to prevent death. If none of these are an option and your heart is very weak and and medications don't work, then they would refer to your heart transplant center, which a very small number of people would benefit from. The third condition is atrial fibrillation. Atrial fibrillation has two different problems. One is when it goes very fast, you will have difficulty breathing and palpitation. That can be controlled with medications, which are routinely administered by a cardiologist. If the regular medications do not work and you're still having a lot of palpitations and the heartbeat is fast, they would institute treatment that are called antiarrhythmic medications. If those don't work, then they have advanced procedures called ablation that can be performed in any tertiary care center.